Hello everyone, you are all welcome to lecture number 1285 and today's topic is prostatitis, its causes, symptoms and treatment. When I am talking of prostatitis, ITIS, anywhere if it is given means it is inflammation. It can be acute inflammation, it can be chronic inflammation, it can be due to bacterial inflammation or non-bacterial inflammation. These things are happening to our very important gland in male. It is called prostate gland and it plays very important role. It is in between, we can see your ureter, where urethra, where your urine is collected, and just side by rectum, a very small one gland is attached, and that gland is called prostate gland. It plays very important role, especially for male, and the main function of this prostate gland is it used to manufacture and release semi-solid liquid that is called fluid, and that fluid is responsible of taking the sperm to the fertilization, and that's why it has very important role. And if in case there is any disturbance or inflammation of prostatitis, first is that the release of this fluid will be drastically reduced, and once it is drastically reduced, there will be problem of counting the sperm will be less, and it will affect directly and indirectly the fertility also of the human being. So here I am mainly discussing, because which is becoming very common after the age of 60 or 70, and people get inflammation, sometimes chronic inflammation, and there are four type of this prostatitis. One is called simply acute inflammation, second one is chronic inflammation, third one is bacterial inflammation. Due to bacterial infection we get the inflammation in our prostate gland, and the fourth one is that is without symptom, asymptomatic inflammation. And in most of the cases it happens that many people, they don't understand whether they are suffering from prostatitis or not, because it will not show any symptom, and by that time their 80-90% prostate cells will be damaged. And this damaging and inflammation, chronic inflammation, can be two types: cancerous and non-cancerous. Non-cancerous means non-malignant, cancerous means malignant. So we have to go through some tests. On the basis of that, biopsy and some other test is there, so that we can establish whether it is malignant or non-malignant. But in most of the cases, people who are having some condition of chronic or bacterial inflammation, they get some symptom, and they will be having some causes, lifestyle causes, genetic factor, and also always feeling weak. Then hormonal imbalance. Hormonal imbalance means sometimes if it is not properly balanced during the puberty time, when they are entering in teenage, that is also one of the factor. Or after pregnancy, hormonal balance is disturbed. That may be the reason. Again, stress and strain, if you are continuously living in that stress and strain, that may be the cause and factor. And also your diet. Once your diet is not a rich source of anti-inflammatory and antioxidant food, and several times I am saying now, your best food which are known as anti-inflammatory and antioxidants are fruit and vegetable, mostly colored one, and you add in your diet to reduce your, in general, acute or chronic inflammation by taking these foods up to 75 to 80%. Add all this color so that you can get a good amount of anti-inflammatory compounds, because they are very rich source of phytochemicals, and those which are present in flower, fruit, vegetables. And these phytochemicals, they are powerful anti-inflammatory and antioxidant. For example, nowadays, phenol compounds, that is benzopyrenonuclease, they are phenolic and they are very powerful anti-inflammatory. And your all colored fruit, flower, vegetable like red, yellow, blue, pink color, all are very rich source of phenol compounds like quercetin, epigenin. So these are very, very important phenol compounds, and they can drastically reduce the condition of inflammation, and that is affecting your not only prostate gland and some other part of the body, and even some other organs like kidney, like heart, like lung and liver. So let me show you the images of prostate gland. So you can see here very clear picture of prostate gland with two lobes, left and right, and it is just attached or linked very close to a urethra, that is called ureter, where all the urines are collected. And if there is enlargement or there is inflammation, it will create the pressure on the your urethra or the lobe where the urine is collected on ureter. And once there is pressure on ureter, definitely you will be always feeling, and there will be sensation of going to the urination. So that is the factor. And this one is also very close attached to rectum. So once it is having some inflammation or chronic inflammation, the whole area, pelvic area is disturbed, and you will be having sometimes back pain, sometimes pelvic pain, sometimes some urinary symptoms, like once you are releasing urine, you will get the pain. When you are going to stop at the end, then again you may get the pain. So it's a very much disturbing, and your life will be totally uncomfortable once you are suffering from that is inflammation of prostate gland, that is called prostatitis. Here you can see the two conditions. One where the prostate gland is normal and which is not putting any pressure to urinary bladder where urine is stored. But once it is enlarged, it is suffering from acute or chronic inflammation, that is where it is swollen, that type of structure, and it will become large and it will start putting pressure on your urinary bladder. So with this prostatitis condition, you will be having a lot of problem. It's very clear picture is shown here. This black stone type, this is the formation of tumor within the prostate gland, and it is cancerous. It is a malignant. And when this condition comes, you have no option except to go for surgery, and it is very critical condition. Once such condition comes where your prostatitis is showing the signal of cancerous tumor formation, and that tumor formation and enlargement, you can see it is putting pressure to your rectum side, and at the same time that is urine bladder where urine is collected. Now here it is shown inside your prostate gland some damaged tissues and cells, and they are all malignant, cancerous cells. It shows that your whole of the prostate is now became cancerous, and only option is to rather than to treat, because it's very difficult to treat just this condition where a lot of your cells and tissues of your prostate gland is damaged. The only option is to go for surgery. So here I have given in the form of summary with some explanation. Number one, prostatitis is actually inflammation of prostate gland, and which can cause pain, discomfort, and urinary symptoms. If I say urinary symptoms means during urination you will feel discomfort and pain once you start and once you are going to stop. That is called urinary symptoms, and there are mainly 4 types of prostatitis. So here nowadays, after a lot of research publication, it has been identified these 4 categories. Usually what doctors they are doing, once there is prostatitis, they will treat either as a bacterial or with chronic inflammation, but at the same time the prostatitis may be due to viral and fungal infection also. So here sometimes they miss of using antifungal and antiviral medication. So here number 1 is that is called acute bacterial prostatitis, that is called ABP, and it is caused by bacterial infection and treated with antibiotics. Number 2, chronic bacterial prostatitis, BP, that is CBP, recurring bacterial infection for a long time, so it needs chronic. It needs long duration of time antibiotic treatment. Number 3, chronic prostatitis, that is CP. It is non-bacterial chronic inflammation and damaging of your prostate cells, that is called your chronic prostatitis. And number 4, asymptomatic means without symptom prostatitis, and many people they suffer this type of prostatitis where they don't have any symptom, and when they are going for some investigation or examination of some other ailment or diseases, then it is discovered that he is already having the problem of prostatitis, means chronic inflammation of prostate gland. Then number 2, that is causes of prostatitis. What are the causes? So number 1 is definitely it is bacterial infection. Second is non-bacterial inflammation, chronic inflammation, damage, and then the third one, non-bacterial maybe fungal and viral, and the third is hormonal imbalance during puberty or once you are getting in teenage. There is drastic change or imbalance of hormone. Because of that reason, sometimes it may happen that you may get prostatitis. And then, of course, this most common factor, that is your aging. Mostly people they get after 60, 70, but is not that only that factor. Prostatitis can happen at any moment. Then number 3, symptoms of prostatitis. What are the dominant symptoms? So number 1 is pain in prostate gland and pelvic region. First symptom is like that, and then second is that is urinary problem. You will get pain, and sometimes the traces of blood will start coming. That will lead to your malignant side, means cancerous damage, inflammation. Then number 3, difficulty in urination and stopping the flow of a urine, you will get pain. Number 4, treatment. What are the treatment? So number 1 is medication. You have to go for antibiotic, but here I have already told you, apart from that, sometimes antibiotic for short duration is not working. It means you are suffering from chronic long-term bacterial infection. So for that treatment, you have to go for a long time. And again, if there is no recovery, it means that you are suffering from fungal or viral attack. So that is one medication. The second is to reduce the inflammation and pain. Doctors will give anti-inflammatory medication and drug just to manage the pain. And then number 3 is very common medicine they are using, that is called alpha blocker. That will block that chronic condition. And then number 4 is ultimate, final. If in case it is too much damage because of infection and inflammation, then surgery is the only option just to remove the damaged cells. Then what are the preventive measures? Prevention. First, good hygiene around genital area. And the second is avoid toxic or irritant chemicals. Avoid to expose. And nowadays, of course, in some mega cities, automatically air is that much polluted. And enough toxins are there, and that can have some health hazard that we cannot avoid. Then number 3 is maintain balanced diet. I am always saying anti-inflammatory, antioxidant foods, that is 80% fruit and vegetable. And then number 4, always stay hydrated, because once you are always dehydrated or you are not taking water always, because we are fluid and our body is in the form of electrolyte, your blood and all these pH value, alkalinity, acidity is maintained because of dilution. So always taking water, always hydrated means it is protecting from lot of other type of diseases, including prostate gland inflammation. Then this number 5, you have to manage your stress. Stress management is very important, because stress is also causing not only prostate gland problems, so many other things are there. So whatever Allah has given you, be happy with that and go on improving your skill and knowledge. And Inna Allaha Maha Sabrin, Allah is with those who are patient. And keep away from lot of acidic and toxic people who are always coming, passing sarcastic comment and social, political, religious. Just keep away and focus with your family members, with your children, with your very good selective friends. And then prostate cancer symptoms. Of course, what I have mentioned, they are part of that symptom, but once it is towards cancerous side, then some more symptoms are added, and that symptom is first, walking difficulty. You will feel difficulty in walking and always feeling weak, fatigued, and feeling exhausted, means low energy. That means it means you are on the road of prostate cancer. Then third is loss of sensation in your feet and leg, numbness, very frequent. That is also towards cancer side. And then swelling of the leg and feet. Of course, swelling of the leg and feet is also one of the indicator for kidney trouble. But at the same time, if your prostate gland is in trouble, is having inflammation, there is chance of getting, we can say, swallow legs and feet. So with this I will stop. Take care of your prostate gland. Thank you very much for watching the lecture.